Welcome to the Massachusetts General Hospital Anticoagulation Management Service, or AMS. We know that you are taking warfarin, an anticoagulant medication that prevents blood clotting, and that you are currently a patient of the Newton Wellesley Hospital AMS. We have accepted a referral from your doctor to continue to provide your anticoagulation-related care at the Mass General Hospital AMS, and we are very happy to have this opportunity. This video will provide you with a brief review of key points about taking warfarin safely. The next slide summarizes the topics that will be covered in this video. Your new MGH AMS nurse will contact you in the very near future, if she hasn't done so already, to discuss specific aspects of your care, such as the lab that you will use and how best to communicate with you. The topics we will review will be reasons people take warfarin, blood testing, what may affect the INR, possible side effects, symptoms to report, safety tips, refills, and communication with AMS. Why do you need to take warfarin, also called Coumadin? There are many reasons people take warfarin. Stroke, irregular heartbeat, and inherited clotting problems are a few examples. How does it work? Warfarin is used to treat or to prevent unwanted blood clots by slowing down your clotting system. A blood test called PT-INR tells us how long it's taking your blood to clot. We then adjust your dose based on your PT-INR. Having regular blood testing is very important. What should your INR range be? It is based on why you need warfarin. INR is measured on a scale that represents how long it takes your blood to clot in seconds. The usual range of INRs for patients taking warfarin is somewhere between 2.0 and 3.5. Your doctor tells us where yours should be. If you're not sure what your range is, just ask your AMS nurse. And remember, if your INR is low, your blood is too thick, which increases your clotting risk. And if your INR is too high, your blood is too thin, which increases your bleeding risk. Our goal is to keep you within your target range. Factors that can change your INR and that should be reported to your AMS nurse include medications. Many medications interact with warfarin. It is very important to call your AMS nurse whenever you start or stop any medications, including over-the-counter medications. We may need to check your INR more frequently. Medications to avoid. These include aspirin, unless prescribed by your physician, non-steroidal anti-inflammatory drugs, such as Motrin, ibuprofen, or Aleve, and herbal remedies. All may increase your bleeding risk. Is Tylenol okay? Yes, but if using in large amounts, it may cause your INR to go up. Call us if you need to use Tylenol for more than 1 or 2 days. Changes in health, such as illness, fever, infection, nausea, vomiting, and diarrhea, can all cause your INR to change. If you have any questions about whether or not your medications or herbal supplements you are taking will change your INR, please call us. Factors that can decrease your INR include your diet or vitamin K intake. Vitamin K is mostly found in deep green leafy vegetables. Vitamin K is also present in most multivitamins. Increased vitamin K can decrease your INR. It is not necessary to change your diet, but you should keep your dietary intake of vitamin K the same from week to week. Other dietary factors include protein supplements or shakes, such as Boost or Ensure. These can cause your INR to decrease, but with all things related to your diet and warfarin, consistency is best. Call your AMS nurse with any big changes in your diet. Factors that can increase your INR include alcohol. Warfarin works in your liver, and alcohol affects how your liver works. Alcohol in excess can cause your INR to get very high. We recommend moderation and no more than 2 drinks per day. Being sick. Illness, infection, serious injuries can all cause your INR to increase or sometimes even decrease. Call us with any health changes. Possible side effects of warfarin. Minor bruising or bleeding is common when taking blood thinners. You should seek medical care for any bleeding that you can't stop at home, blood in your urine, black or tarry stools, coffee ground vomit, or injury to your head. Seek medical care for any signs or symptoms that concern you. If you are seen in an emergency department, urgent care, or doctor's office, please notify AMS after your visit. Signs of blood clots. A heart attack, or MI, myocardial infarction, symptoms include chest pain, pain in your arms or jaw, heartburn, and nausea. Stroke, or CVA symptoms include sudden numbness in your face, extremities, especially one side more than the other, sudden changes in your vision, speech difficulty, sudden headache, or dizziness. Blood clot in your lungs, or pulmonary embolism. Symptoms include unexplained shortness of breath or chest pain. If you think you are having signs of a heart attack, stroke, or blood clot, call 911. Signs of clots in other areas of the body include pain, swelling, or warmth, especially in the arms or legs. Safety tips. Avoid injuries, falls, and high-risk activities. Use proper safety gear, such as a seatbelt in the car or helmet if you're riding a bicycle. Carry your med list in your wallet. Include all over-the-counter medications in addition to your prescription medications. And wear a medical alert bracelet. These are available at most pharmacies and online. Warfarin refills, dose, and pill color. How do I get refills? Contact your doctor who prescribes your warfarin. Safety reminders. Know your dose and which pill strength you use. The color of your pill indicates the strength of the pill, as warfarin pills are color-coded. You should only use one pill strength to prevent a mistake. If the pill color changes, the strength has changed. Call AMS if your warfarin pill color changes. When should I call AMS? Please contact us if you are told to stop warfarin for any reason, such as for procedure, surgery, or dental work. If your address or phone number changes. If you miss a dose, and remember never double dose, contact your nurse for guidance. If you start or stop any medication or over-the-counter medication, vitamin, or supplement. If you are sick for more than 1 to 2 days. If you are seen in an emergency department or urgent care. If you plan to travel, or if you plan to become pregnant. AMS stands for Anticoagulation Management Service. Our main phone number at the Mass General Anticoag Clinic is 617-726-2768. Our office hours are Monday through Friday from 8 a.m. to 4 p.m. AMS nurse phone lines are answered during those hours. Messages left between 8 a.m. and 4 p.m. will be returned as quickly as possible and usually by the next business day. For weekends and holidays, contact your primary care provider or other doctor who prescribes your warfarin. Every patient has a primary nurse. Your nurse will provide you with her direct contact information when she speaks with you by telephone, most likely in the next few weeks. You will be contacted by one of our secretaries to schedule this telephone discussion. Thank you for your time. I hope you found this slideshow informative, and we look forward to working with you at the MGH AMS. Thank you.